Welcome to today's session on how to prepare for your first IVF clinic appointment by Apollo Fertility. To speak on the topic, we would like to welcome Dr. Ankush Rawat, who is our in-house consultant. He has done his MBBS, DGO, CCDM, DNB. We welcome you, Doctor. You can now take over the session. Thank you.
Thank you. Thank you, Padma. Good evening, everyone. I am Dr. Ankush Nandakishore Raut. I am a consultant at Apollo Fertility Borivali. Today, we are going to discuss about how we should prepare ourselves or what you can expect during your first visit to your fertility consultant. The first and most important point come to your mind is when to visit the consultant, right? When to actually have a visit to a fertility center. So when you are married since 1 year almost and you are trying since 1 year after a marriage for a pregnancy, having an intercourse in a proper fertile window, but still you fail to conceive, and if your female partner age is less than 35 years, less than 35 years, then this is the proper time when you should consult your fertility consultant as early as possible. But if your female partner's age is more than 35 you or in between 35 to 39 years age group, then in that condition, after trying continuously trying for 6 months for a conception, you should visit a consultant if you fail to conceive. And if your age is more than 39, then 3 months is the appropriate time. If you fail to conceive within a 3 months, then you should visit the consultant as early as possible. Why this is important? Because as the age increases, your chances of having pregnancy goes on decreasing. So before 35, you almost 80-83% couple conceive within 1 year, and almost 95% of them conceive within 2 years of trying for a pregnancy. But in case of a woman who is more than 35, the chances of pregnancy as well decreases, as well as chances of abortion also increases. So if, because the natural chances also decreases, it is very important to know your egg reserve and to know what time you are having in order to plan for the pregnancy, because after 35 your biological clock starts ticking, and you may have 2 years in hand, sometimes you may have say 5 to 6 years in hand in order to conceive. So it is better after 35 that you should visit the consultant as early as possible. And secondly, how you should prepare yourself before going to a fertility center. If you know certain terminologies about the reproductive system or the certain things like how the reproductive system works, what are the parts of the reproductive system, what organs actually works for the reproductive system, then it becomes very easy for you to discuss with the consultant. Because what's happened during your visit, during your consultation, your consultant may use some of the medical terminologies which may confuse you. But if you prepare for those terminologies beforehand, then you will be able to better understand the outcome of a discussion, and you will be able to come to some conclusion. You will be able to understand why the pregnancy is not happening, what can be the probable reason, and you will be able to take an appropriate decision based on the discussion. For example, if we consider a female reproductive system is consist of ovary, fallopian tube, uterus, vagina. And how it works? It works in coordination with the pituitary gland, that is also called as the master gland, which secretes the hormone called follicle stimulating hormone and luteinizing hormone. So with the help of these follicle stimulating hormone and luteinizing hormone, the start producing eggs from second day of the periods. It start developing and maturing egg from the second day of period till approximately 14th day of the period. Around 14th day of the period, the eggs get mature, it gets ruptured by 14th to 16th day. And if you have an intercourse during that time, the sperm will get deposited near the upper portion of vagina, and from there it travels through through a endometrium into the fallopian tube, and then it will meet the egg there inside the fallopian tube. After meeting the egg in a fallopian tube, fertilization occurs. The embryo develops initially for next 3 to 4 days, and by 5 to 6 days, it will come back into the uterus. It will stick to the endometrium. It will grow there for 8 to 9 months, and it will come out in the form of baby. So this is how the natural pregnancy occur, and this is how the natural pregnancy grows, reproductive function works in case of a female. Similarly, in case of a male, there is a testis which produces a sperms. There is a vas deferens or the epididymis. It's, you may say, a tube which carry a sperm from a testis into the penis, and there is a master gland which controls the production of a sperm into the testis. So in case of a male, if there is problem either in a testis or in a pituitary gland or in the duct which carries the sperm or in the penis itself, like failure of the erection with, or there is a premature ejaculation, in all these cases also, you may a male partner may fail a problem in a conception. So these little medical terminologies you should know before actually visiting the fertility consultant, in order to take out maximum out of the discussion which you may have with the consultant. So third most is, what can be the cause? Because once you are preparing for the consultation, you may thought that this might be the cause because of which you are unable to conceive. Sometimes what's happened when you come with the a certain mindset that I may have a problem with the ovulation, that's why pregnancy is not occurring, then in that case you may fail to accept the actual reason which consultant will find out during your evaluation. So rather than going with some predetermined mind, keep your mind open, that, and always get ready for the surprises, you may say, or for the healthy discussion with the consultant, and to accept the thing that after evaluation my predetermined diagnosis may change after the evaluation. So go with the open mind to the consultant in order to discuss what can be the cause, right? So during the consultation, there are some causes which, because of which you may fail to conceive, right? So cause can be in the ovary itself, which we call as an ovulatory disorder. Sometimes it can be a less number of the eggs in the ovary, which is called as premature ovarian insufficiency. Sometimes there can be cause with the fallopian tube, where tubes are blocked. Sometimes it's an uterus which is at the problem. Sometimes there are fibroid in the uterus, sometimes adenomyosis. Sometimes there can be problem in the vagina itself, like the vaginismus, because of which there is no intercourse and patient fails to conceive. Similarly, in case of male, certain causes we should read about before going to the consultation. Like in a male, there are husband's analysis is very important. If the sperm count is less than 20 million, then the condition is called as oligospermia, where also the chances of pregnancy decreases. Similarly, if the sperm count is less than 5 million, then it's a very severe oligospermia, where you may need to go for the test tube baby. Yeah, sometimes there can be problem with the testes, sometimes there can be problem with the penis also. So all these problems, all these causes will be evaluated by your fertility consultant when you go to visit the when you go to visit the consultation. So let's see what evaluation exactly will be done by your consultant during your first visit, or what investigations you should expect will happen in a clinic when you go for the consultation. So, as we all know, for the consultation, it is important that male and female partner both should be evaluated. So, both male and female partner both should go together in order to have a proper fertility consultation, and in order to have a proper evaluation for the cause of a infertility. So, in case of a female, we do simple some blood test, which will include a blood test to know the exact status of the ovary, like AMH. Then we do a blood test in order to know the status of the hormone, like TSH, thyroid stimulating hormone, and the prolactin level. Apart from that, in order to know how the general condition of a patient is, we do a hemoglobin, we do a viral marker testing, as well as rubella test, presence of IgG rubella antibodies, as well as liver function test and the renal function test, if needed, will be done. In case of, and also apart from this blood test, we will do a sonography in order to see how the uterus is, how her ovaries are, how many number of eggs are there in a ovary. In some cases, we may ask you to do a tube test either with the help of a sonography or with the help of an X-ray called as hysterosalpingography. While in case of a male, we do a simple test called semen-analysis as well as the viral markers. So semen-analysis and viral markers are usually enough for the male. in order to have an initial evaluation. So by doing this simple test, we will come to know what can be the probable cause of your infertility. So this probable cause can be with ovary, it can be with the tubes, it can be with uterus, it can be with the testes, it can be with the a tube which carries the sperm from testes into the penis, right? So after evaluation, your doctor will come to some conclusion. You know, he will tell you about what can be the probable cause of your infertility, right? So as I already told you that cause can be in a female, cause can be in the male, right? So after evaluation, we will see whether that patient need simply medication, or that patient need intrauterine insemination, or that patient need just evaluation, or that patient need an test tube baby or the IVF. Not all the patient will require a test tube baby or IVF. Many patients conceive just by having oral medication and proper timed intercourse, that is the intercourse in a fertile window. While some patients may require the help of a intrauterine insemination, while there are very small number of couples who will require a IVF for the test tube baby, right? So let's see which couple may require a test tube baby, because once you go with this predetermined mind that I may require a test tube baby if this diagnosis will come, then it become very easy for you to accept the diagnosis as well as to accept the treatment. Because many times we have a myth that IVF is just for the couples who are old age, and young couples usually maybe more than 1 year after the marriage doesn't require any type of a treatment or doesn't require test tube baby at all. But the requirement of a test tube baby depends on what is the cause of your infertility. So if your female partner is having bilateral tubal blockage, that is both the tubes are blocked, then many of the infertility consultant may advise you to go for the test tube baby, because it is having a better chance of success rate as compared to the other modality of a treatment. Similarly, if the female partner is having advanced age and having a low AFC, that is they are having a less number of eggs in their ovary, in that case also it is better to go for the test tube baby as early as possible. Similarly, if you are in the perimenopausal age group with the AFC number is very less, then you may have to opt for the test tube baby as early as possible before your ovary stop producing egg any further. Some patient may require a donor eggs. In that case, also a test tube baby is the best option, because without test tube baby, donor egg cannot be done. Similarly, if the patient is having the recurrent pregnancy loss, then in that cases also test tube baby with the help of pre-implantation genetic testing for aneuploidies or monosomies will be a better option. Similarly, if the couple is having some genetic abnormality either with the mother or with the father, then in that cases also pre-implantation IVF with the pre-implantation genetic testing is the better option. Some patient may require a surrogacy because of the loss of the uterus or unavailability of the uterus. In those cases, also test tube baby is a better option. Similarly, in case of a male, if the semen analysis if semen analysis suggests that sperm concentration is less than 10 million per ml with the grossly abnormal sperm, or if the sperm morphology is very poor, or if the sperm motility is very poor, or if the sperm quantity is less than 1 million per ml only, then in those cases ICSI, that is intracytoplasmic sperm in test tube baby with the help of intracytoplasmic sperm injection, will be a better choice as compared to just doing a IU or waiting for the conception to happen. So these are the few cases in which you may need to go for the IVF. But in the rest of the cases, like a simple ovulatory disorder, suppose PCOD is there, then in that cases simple medications and timed intercourse or simple medication or IUI may help you to get conceived. In case of vaginismus, IUI may help you to conceive. In case where the sperm count is more than 20 million, but patient, but a couple partner have a problem of premature ejaculation or retrograde ejaculation. In those cases also, the intrauterine insemination can help you to get pregnancy. You may not need the IVF for the test tube baby also, right? Now, what you should carry along with you when you go to the doctor? When you go to the doctor, carry all of the records of your previous appointments as well as all the records of your previous ailments. Suppose you had some surgery in the childhood, right? Then you should carry the records of all those surgeries also. Apart from all these history papers, all these consultation paper, your medical records, you should carry a piece of paper mentioning the questions you need to ask to a consultant in the first visit. So what are those important questions? First of all, doctor, what evaluation I and my husband will need? Secondly, what, after evaluation you should ask a doctor what can be the cause of your infertility. After that cause, what can be the appropriate treatment for this? What are the success chances, success, what are the chances that the treatment in my case will give us a success in order to achieve the pregnancy? And whether I required IVF with the help of ICSI, or whether I required a test tube baby with the help of ICSI or IVF, or there are any other condition which can be improved before doing a certain type of a treatment, right? All these questions should be asked to the consultant. What's happened? And sometimes you may have a question regarding what to eat, what not to eat, what lifestyle modifications you may need, whether you should stop smoking or not. So all these questions you should write on a piece of paper and then go to the consultant when you go for the first visit. Because what's happened, out of the anxiety you may not be able to ask all the questions, or you may forget the questions which you want to ask to the consultant. So it's better to carry a piece of paper mentioning all the questions which you need to ask the consultant or your fertility doctor. So, doctor. So after having a consultation, your doctor may ask you to do some lifestyle modifications. So those lifestyle modifications are like stop having smoking, stop having alcohol, stop having intake of a coffee as less as possible, do regular 20 minutes of exercise, pranayam, yoga, have a healthy food, have a healthy diet, and have a intercourse in the proper fertile window. So all these instructions your fertility consultant may give during when you visit the consultant for the first time. So apart from that, I would also like to tell you that you should know how a certain type of treatment works in case of a for the conception, like how the IUI works, how your fertile window works, as well as how your IVF works. You can read this information on the YouTube or on a Google, or you can have this information from your friend before going to the consultation, because that will give you a knowledge about how exactly these process works. IUI, how the IUI works, how the IVF works. Once you have some sort of a information that this actually works like this, then you will be in a better position to ask a relevant questions to your doctor in order to achieve to a certain conclusion that in what time you need to have a treatment, and what appropriate treatment can be for you for a certain condition, right? So I will give you a brief how all these things works. Suppose if you need a medications along with the timed intercourse, in that case we will be giving you a medication from second or third day of your periods, which you may need to take for 5 to 6 days. After that, we will be doing a sonography around 7 to 10th day in order to see how the follicle is maturing. And once the follicle mature, by examining a size in a sonography, we will ask you to have an intercourse in order to maximize the chances success chances. So this is called as a timed intercourse. This is follicular monitoring with the timed intercourse. In certain cases, you may not want to go for the follicular monitoring. In those cases, I will just give you a medication from 5th day of period till 7th day of period, and I will ask you to have an intercourse from 10th day to 20th day every alternate day. In case of IUI or the intrauterine insemination, we will give you certain medications for the development of your eggs And when the egg is about to mature, we will take a sperm from your husband. We will take a semen sample from your husband. We'll separate the motile sperm from that semen sample, and we will insert this motile sperm inside the uterus at the time when the egg is about to rupture. So this is called as intrauterine insemination, where we have assisted the sperm in order to travel to near the egg or the oocyte. While in case of IVF, from second day of period of a female partner, we will give some hormonal medications which will help all the eggs to develop in the ovary. What's happened naturally, only egg one or two eggs develop. But in case of IVF or the ICSI, we want all the eggs which are available in the ovary to develop or to mature. So the hormonal injections will be given from second day of the period in order to help all the follicles to mature. And once the follicle get mature, we will be retrieving them in the laboratory with the help of a sonography machine. And after retrieving in the laboratory, those from that follicular fluid, eggs will be separated, and that eggs will be mixed with this sperm, and they will be kept in a incubator in a laboratory for development of an embryo, maybe for 3 days and sometimes for the 5 days, in order to make the good blastocyst. Once the embryos are there, those embryo either will be transferred into the uterus or they will be frozen in order to transfer in the next cycle, depending on what type of problem you are having. So this is in short how the IVF works. So in IVF, we make an embryo outside in the laboratory. That is, the fertilization and initial development of the embryo is ensured in the IVF. So success rate in the IVF is far better as compared to IUI or the timed intercourse. So this is how all the methods which can help you to have a conception. So thank you all. This is all about how you should prepare and what you should accept during your first visit to a fertility consultant. So as I already told you, if you are already married since 1 year, tried since 1 year, female age is less than 35, if you are still not able to conceive, then it's a appropriate time when you should visit your fertility consultant and discuss what can be the probable cause, what evaluation you need, and what can be the probable treatment which will help you to conceive as early as possible and with the best possible way. Thank you all and best of luck. Padma,
Thank you, doctor. Thank you so much. Thank you.
you welcome. Are there any questions?
That's it. Thanks. That's all. I'll just end the live session. Thank you.
Sure, sure. Thank you. Thanks a lot.
Thank you.